It is Tuesday, January 12th, 2021. And for the first and only time, say Happy New Year to everyone. It's just on the edge of when you can say that. Hopefully everybody's having a decent start to the year. We are into episode 167 of our Kahnawà COVID-19 Task Force updates. On the program today, we have three guests. However, it should be a fairly brief program. So bear with us. We'll start things off immediately with Ratsénhaienhs Cody Diabo of the Mohawk Council of Kahnawà, who is joining us via computer today. So how are you, Cody?
Segu, glad to be here, coming to you from my front porch.
All right. Well, it's nice enough that you can actually sit outside if you wanted to. Not too bad a day. You had a couple of things you wanted to say, so let's get right to it.
No, I just wanted to come on to the show and talk about the current situation and, talk to the community. Although 2020 was, putting it just to say 2020 was hard is underselling it. 2021 also hasn't started off too great. But it also shouldn't define, the year. It shouldn't also define our approach to how we're gonna start handling the situation. Right now we're sort of on the uptake, but there's still time to bend that curve to the direction we want to have it, and that's going down, not up. So I do know there's about 20 cases active right now. But I think as a community, following the directives, we can see those numbers starting to decrease and kind of be how we were in the first wave, getting a handle on it.
All right. So,
and, just because I guess really what it is, it's, I understand there's a lot of things out there, a lot of people maybe don't think of the virus as that big of a threat, or we're hearing a lot of the information out there, and it's important to say that a lot of the information, especially on social medias, aren't accurate. And it is real for people, especially community members battling it right now. They're scared for themselves, they're scared for their loved ones. There are mothers and fathers who can't hold their children and tell them everything's going to be all right because of the virus. There's who are also worried about their parents, their grandparents, and those feelings are real, and the anxiety that they're feeling is real. And it doesn't help, I think, when maybe you hear or see people not following the directives and sort of living life the way we normally would. But right now we gotta just make sure that we're doing everything that's being asked of us as a community. One day I hope that. Soon we can start looking back at this, remember the struggle, not forget what happened, what we went through, but also knowing that, what we did was we did it for the community. We put the community above ourselves and not, went about it just to make sure that we were happy. It's larger than that. This is a test for the whole community to come together again and battle the invisible enemy, so to speak. And it's not courageous to go out without a mask on, or go gatherings, or go up north, go traveling. It's more courageous to stay home and put the others' needs ahead of yours. That's true courage.
Let's talk a bit about, you as a council chief, as an elected official. You get a lot of people who, when they see you, they just want to talk. They have ideas, they have complaints. What's it been like for you as a council chief in these last few months, and more specifically, very recently?
Well, it's definitely very different. I myself in general, I'm a very sociable person. I like to be out. I don't necessarily say working from home isn't my thing, but I'm doing it. We have the technology. Let's utilize it. I'm accessible. I have social media, Facebook and all that. So if people have questions, I don't mind people reaching out to me that way. I'm open to that. That's why I'm here. We have also our whole email. It's similar to how it used to work. Also, you would call the MCK building if you wanted to speak to me. A message gets sent to me. They'll ask you for, a callback number, and I can call you back. That's during work hours. If you have questions after hours, like I said, you can reach out to me on social media. So it's
So if the,
it's not hard to adjust. I mean, given myself, it wasn't a hard adjustable period, going from in-person meetings to doing everything virtual.
all right, if there was one overriding message that keeps coming back to you from the community, what would that be?
I guess really a lot of it is, how are we going to get through this? How are we going to start getting back to our normal way? And there are, things that we have been doing. We've seen from the first wave, following the directives, we had a fairly good summer. And I think maybe that sort of lessened a lot of the anxiety about the whole situation, which at the time I think is good. But, coming into winter when everything had to be kind of closed back up, that freedom, so to speak, I'll say, quote unquote, freedom, of being out in the open like that had an adverse effect going into the winter time. So, I think for me, it's, let's hunker down. Let's try to get through these next couple of weeks. Let's start bringing that curve down. There's light at the end of the tunnel with the vaccines coming. That's not the end of the whole situation. I mean, there's still going to be the measures afterwards, but we can see we're getting there. It's just going to take some time and some hard work.
All right. Well, thank you so much for taking time to talk to us from the comfort of your office on your front porch, Cody.
Well, thank you for having me, and I'm glad to be here. And I just want to tell the community that we have technology right now that can help us get through this. There's FaceTime, there's video chats. I know we're very social people in general, not just our who we are, but in general, humans are very sociable creatures. I won't even say creatures, species. But you know what? We have technology on our side, so let's try to use it during these next few months as much as possible.
All right. Well, Ratsénhaienhs, Cody Diabo of the Mohawk Council of Kahnawà. Coming up next from the Academy Memorial Hospital Center is the Executive Director, Lisa Westaway. Lisa, it's all yours.
Good afternoon. Have a very short update today. I did receive information from the ministry regarding the hospitals in the Montérégie area. So that includes Anna Leberge, Charles Lemoine, Pierre Boucher. So I think it's important for the community to be aware that those hospitals, the ICU beds, are at 100% capacity right now. They're in the process of seeing how they can increase their beds to 150% capacity. In order to be able to do this, they have to cancel many what they would call non-emergency surgeries. What's non-emergency to them may not be the same thing as what's non-emergency to us, and it means that some people who do require services may not receive them in a timely manner. So it is important that you know that this is happening, and what it means is that Quebec is in a very difficult state, and that would explain the measures that are in place right now, and again it explains partially the measures that we have in place as we do our part to try to keep all of us out of the hospital centers. And so they are at 100% capacity. They are canceling services, so if you are expected to have surgery, you may not receive that call, or you may have to wait a little bit longer. And we know that human resources are being stretched thin as well. As for our community, so I can give you an update on number of cases. So we presently have 20 active cases in the community. We've actually had a total of 93 positive cases. I've had that question recently from various people. So we have had a total of 93 active cases, total cases. We have 20 active right now. We do have also several people who are in quarantine and some who are awaiting results. We continue to test. Just a reminder that if you feel that you have a slight head cold, you just, you for less than 24 hours even, you just don't feel well, please call the testing site to be tested. Also a reminder, if you are working and you have symptoms, that you should stay home. Nobody should go into work sick. So these are just some quick reminders for you to think about every day when you wake up. How am I feeling today? Do I have any COVID-related symptoms? Stuffy nose, headache, cough. You don't have to have a fever to have COVID, and in fact, many of the cases we've seen recently do not have fever. So really just being unwell, feeling like you have a little cold, warrants you calling the testing site to be tested. So that's my update for today. Please stay safe, stay home, stay with your family bubble as much as possible. Thanks.
All right, thank you very much, Lisa. And our final guest on today's program is the head of the Kahnawake COVID-19 Task Force, Lloyd Phillips.
Thank you very much, Joe. Thank you, Lisa. Thank you, Cody, for the support and the message to the community. And I just want to make a quick point regarding that. And I always appreciate having a elected official, elected chief, come on the show and lend support to the community, lend support to the task force, and also at the same time, I like to remind the community that even though they're here and they are political representatives, the task force itself, we remain non-political, because we did get several questions and comments over the past few days and few weeks that are more politically oriented, and so if you do have a question that you feel need to be addressed by the elected chiefs, and by all means, please direct them that way. We're doing our darndest to make sure that we stick to our mandate, which is to make decisions based on the best interest of our community in terms of health and safety, and to minimize the spread of COVID-19 in our community. As we said last time, this week is a week of assessment. As we know, the directive was put into place that closed some retail establishments, and we put together the basically the no gatherings directive. So this week is a matter of looking at the overall situation in the community as it was compared to 2 weeks ago. We don't have all the information that we need at the moment to make formal decisions on anything, but things are starting to look much more or somewhat more positive than they did a couple of weeks ago. But we have not been able to project any determinations yet. We will be doing that over the next couple of days. We do have a task force meeting tomorrow where we'll be presenting some additional information and having I'm sure what will be a good discussion on the next steps forward. As we know, the directives that are in place, they go to, currently they go to a maximum of the end of the month. And depending on how things go and if things are on the right trajectory, hopefully, as I said on K103 during the week, that in the coming weeks, we could talk about next steps in terms of reducing measures and looking more towards the positive side of moving forward in the pandemic, and looking more towards the vaccination of our community and so on. So hopefully, again, we're rounding that turn and we're heading down the path that we really want to see our community on. So again, I think it's important for people to understand, I guess where we are, and we're gonna keep monitoring that, and we will have more information very shortly, for the community on that. As we know, Quebec has instituted a curfew and basically a complete lockdown of the province, and that's going to be in effect until February 8th. I think that just reflects the dire situation that the province is in. They implemented these measures, to try to, I guess, stop the spread or stop the trend, at the very least, of where the cases of COVID-19 were going. If you look back from November and to December and then to early January, the numbers have been doubling and skyrocketing in terms of positive cases. Just seems, like a month ago or so, we were talking about, an average of 1,000 new cases per day. Now we're talking, 2,500, 2,600, and even one time last week was over 3,000 cases in one day. And as Lisa mentioned, the hospitals on the South Shore as well as in the cities are at or near capacity. And so again, we have a collective responsibility to ensure that we protect that the healthcare system, so that if anybody needs it, obviously including community members, that it's available for them. And we decided that we did not need to impose a curfew in the community for a couple of reasons, but mainly we feel by people abiding by the stay-at-home directives, household-only directives, the fact that many people are working from home or various businesses are closed, that is enough to keep people from moving. And we said the primary objective of the directives that we put in terms of in the past little while is to stop people from moving, because the virus only moves if we move. So we figure if people stay home as much as possible and minimize non-essential travel, certain non-essential businesses not opening, that we could accomplish that goal. And hopefully that's going to be bearing fruit over the next little while. So we looked at the whole situation and we felt adding additional level of measures on the community was not required. Quebec is doing their thing. Keep in mind, if you do leave the territory after 8 o'clock, you are subject to the laws that are out there, and they're actually pretty much everything is closed anyways after 8 o'clock, so there really should be no reason to leave the territory. But if for whatever reason you do leave, keep in mind you are subject to the laws out there. It's unfortunate that it had to come to that in Quebec, but we believe that they acted a bit too late, and now they had to resort to the strong measure of a curfew to try to break the trend. We're seeing signs of that happening, and hopefully it's going to continue down that path. But if we let off the gas now, collectively, we might see things start to regress. And we've seen that light now at the end of the tunnel, and let's keep it going that way. So with that, I just wish you a Happy New Year. As Joe mentioned, this is probably the latest time I think you probably get away with saying that, but I haven't been on Facebook Live yet this year. So Happy New Year. 2020 was a heck of a year. We all lived it. We all know what happened. 2021, we still have some weeks ahead of us that are going to be rough, and we're going to have to buckle down and hunker down. But there is, like I said, that light at the end of the tunnel, and 2021 is looking much more bright. Yawa, Kahnawake.
Thank you so much, Lloyd. Just a note, it's funny, we've been doing these programs now. There's been 167 of them. In the past, we used to have the hand sanitizer right here, and people complained that it was making a little noise and it was a little, messy for some people. And anyway, so we did it off screen, but just to let you know, we're still doing it. It is just over here. It's just that some people said it maybe was mixed messaging. If we need to, we could put it right back here. We'll consider that in the future, but again, it depends what people think. If you have a comment, send it. That's all I have to say about that. But we are following all the guidelines here at the task force. With that, we'd like to say thank you so much for joining us and taking a little time to hopefully get information that you need so that we'll all be safe in this 2021. On behalf of everyone here, Kahnawake.